The government's decision last week to temporarily pause Johnson & Johnson's COVID-19 vaccine shows how even a tiny percentage of side effects can prompt a quick response.
The use of the two other vaccines, Moderna and Pfizer, is much more widespread in this country, of course. And as Fox 5 I-Team reporter Randy Travis shows us now, their lack of serious side effects is convincing some people to finally take the vaccine plunge.
On December 15, 2020, healthcare workers in Savannah became the first Georgians vaccinated against COVID-19. Now, 4 months and 5 million Georgia shots later, plus more than 200 million across the country, we have a better snapshot of the side effects you can experience from the vaccines.
At the end of the day, the side effects are much milder than the disease itself.
One way researchers track vaccine side effects is through a database called VAERS, the Vaccine Adverse Event Reporting System. Both patients and medical professionals voluntarily report anything unusual they see or experience. As of the beginning of April, 1,076 cases of COVID vaccine side effects had been reported in Georgia. Again, out of nearly 5 million shots. Most include minor issues: feeling hot, headache, chills.
I even made a report. About 8 days after my first Moderna shot, I got this weird rash around the injection site. I thought researchers might want to know about it. The next day, the rash was gone.
The VAERS site even lists reports of deaths after the COVID vaccine, 36 in Georgia. Across the country, the CDC says there have been more than 2,500 deaths reported to VAERS, but a review of all data revealed no evidence that vaccination contributed to patient deaths. Dr. Julie Swan studies the COVID response and has worked with the CDC on previous pandemics.
Even independent of what happens with the vaccine, sometimes bad things happen. Sometimes you have a car wreck, sometimes you have a stroke. And of course, those are terrible things, but it doesn't necessarily mean that it's tied to that vaccine that you had.
The 4-month anniversary of the COVID vaccine is convincing fence sitters to hop down and get in line. According to the Kaiser Family Foundation, in December, 39% of Americans wanted to wait and see. Last month, that percentage was only 17%.
So you decided to wait and see. Mm-hmm. You've waited. What have you seen?
I needed to see it before I was willing to take it.
As a Stone Mountain Park ranger and TSA worker, Tiara Gonzalez could have been vaccinated in January. But she was in that group of first responders we surveyed back then who said they were not rushing to sign up. These low percentages surprised many.
I was honestly thinking, oh, that's nice for everybody that wants to take it.
But not you.
Not me.
That changed in late March, after her mother and other family members received their vaccinations, and the side effects were better known. Tiara got her second Pfizer shot April 10th.
First, we have a little group chat. Everybody was like, no, we're not taking it. Now they're asking me, well, where'd you go and how can I get an appointment?
Is it time to stop waiting and seeing? Should they have seen enough now?
I think that we have seen more data on these vaccines than we have seen on any other, really. And, you know, the data is clear. The vaccines prevent severe outcomes and death, and with just mild side effects.
She says the other option is to wait until you contract the COVID virus. Sadly, those possible side effects are well known. Randy Travis, Fox 5 News.